Good morning, good afternoon, wherever you may be. Hello and welcome everyone. My name is Antu Hossain. My pronouns are she, her, and I am the Global Health Impact Officer at CanWaCH, which stands for the Canadian Partnership for Women and Children's Health. Though you are all joining from across different locations today, many of you in the comfort of your home, for me, home is Toronto, and I'm grateful for the stewards of the land who have made it possible for a settler like myself to live, work, and play on the traditional lands of the Haudenosaunee, Wendat, and most recently, the Mississaugas of the Credit. As we talk today about data sharing practices today globally, I hope you can critically reflect on our responsibility to decolonize data practices wherever we can as part of reconciliation, and to bear in mind how data is governed, owned, and applied. Our purpose today in this conversation is to make space and to acknowledge a lot of the barriers that we are facing today with respect to data sharing. We can completely acknowledge that these barriers are very real, and we'd like for us to be uncomfortable together, to really understand what are the standards and norms in which right now we're being expected to data share in the very challenging time that we're in. So we have quite some great presentations today to line up that conversation. We have David Megginson, who is from the Center for Humanitarian Data, who will share more on these particular barriers that we're seeing in this sector. And following that, we'll have Jessica Ferne, Director of Global Health Impact at CanWaCH, who will go into more as to how the CanWaCH Project Explorer tool is a platform for data sharing and what we have learned so far in our process with it. The presentations will happen one after another, and then we will move directly into the discussion period, where once again, I encourage you to share questions throughout the presentation in the Q&A box. Over to you, David.
Thank you very much, Antu, and thank you everyone for joining us today. I'm looking forward to our conversation after my short introduction here. If we could jump to the next slide, I'm David Megginson. This is sort of my standard bio. I've been involved in everything, open source, open data, back to the late 1980s. I've been involved in standards for over 20 years. What I left out of here is I've also was the architect for the Government of Canada's buy and sell procurement site, which some of you may be familiar with if you've ever had to go there to bid on government contracts, and was deeply involved in getting the Government of Canada to open up and share its data on corporate procurement during my years that I was doing that early this decade. Feel free to use the pronouns he and him with me. And I'm very happy to be joining you from the beautiful city of Ottawa on traditional Algonquian territory. Slide, please. So I work currently with the UN's Humanitarian Office, UN OCHA, or in French, BCAH. We're responsible for coordinating humanitarian response. Unlike UN agencies like UNICEF, or UNHCR, we don't deliver any services or support directly to affected people in a crisis. We try to make sure that all the big agencies, INGOs, and others work together to coordinate their responses during a humanitarian emergency. And we have, we believe that OCHA adds some value to that. A few years ago, OCHA launched a Center for Humanitarian Data, specifically devoted to improving data literacy, data privacy and protection, data standards, and data sharing across the international humanitarian community. We have offices in all the locations you can see on the screen. Those are our official presences. In addition to those, many of us, like me, work from home. As I mentioned, I'm in Ottawa. I have a Canadian colleague, Elnio Fogneton, who may or may not be familiar to anyone who's been at McGill and worked in this area, who works from just north of Montreal right now as well. Slide, please. So before I get into the nitty-gritty, I just want to talk for a minute about what I mean by humanitarian data, because what I mean from a UN perspective might be different from what many people on this call are thinking of. Obviously, in a broad sense, humanitarian data is about anything helping people in an emergency. But from the UN point of view, it's specifically around coordinated international responses to emergencies. So we, on our team, wouldn't be dealing with data, say, about floods in Winnipeg. That's obviously humanitarian, but it's not humanitarian for the UN. It's an in-country response managed by Canada. Until it becomes international, it's not a matter of concern to us. Now, and that is a very arbitrary line, and I apologize for it. It's just the circumstances under which we work. But what we mean then in our context by humanitarian data are the three types of data you see on the screen right now. There's the data about the context. That's a lot of baseline data, census data, population data, health data, all of that. That's usually data that people have time to collect at leisure. And that's the most likely data to be sex and age disaggregated because it's had time and resources to be assembled. Unfortunately, it often isn't, but it's the best. Then there's the data about the affected people and their needs. Many of your organizations have probably been involved in needs assessments. This is a critical type of information that OCHA helps coordinate. And then there's the data about what's actually happening during the response. In other words, the activities that are going on to help to respond, the organizations, the outcomes, monitoring, and other type data. Slide, please. So I'm very glad that Antu mentioned at the start the word uncomfortable, because this short presentation I'm doing right now is designed to take you from my early optimism at the beginning of this decade to a more nuanced and complex view of data sharing that I think a lot of people have come to. I started this decade very much an open data enthusiast. I still am a member of the open data community, but I recognize the challenges much more than I think I did 10 years ago. So we're going to start with the most optimistic view of data sharing, and then we're going to move to some of the problems before I hand off to Jessica for the next presentation. So first of all, the good news. The Center for Humanitarian Data that I work with has been running the Humanitarian Data Exchange since 2014. This is an absolutely open platform that allows any organization that is recognized as a humanitarian organization, not just UN. We even have data shared by organizations that don't traditionally work with the UN because of their need for independence, like MSF, recognize this as an independent place and have shared data on it. So this is a place where people can share data so we don't lose it between crises. Slide, please. We have a lot of incentives for people to share data on our site. We have over 17,000 data sets from 250 organizations right now, organized by country and tagged by sector, cluster, areas of focus, demining, sex and gender-based violence. There's a very long list of different ways to look at our data. We also give back for the data that's shared. So sometimes we help build custom visualizations, and for any data that's shared with a certain set of hashtags that the humanitarian community is promoting for interoperability, I'm not going into that in this presentation, but it's called the Humanitarian Exchange language. If your data is uploaded with those hashtags, we'll also create instant visualizations to help, like the ones on the screen, to help preview your data. So over the past 6 years, the Humanitarian Data Exchange has had a lot of success making data easier to find, removing friction during crises, and so on. Slide, please. And here are some stats for us right now. I won't read them all out loud. You can take a quick look at them yourself. But you see we have deep engagement both in the UN and the INGO, NGO, CBO communities for sharing data about humanitarian crises around the world. Slide, please. Now, we realized fairly early on that data sharing's not as simple as the early optimism circa 2011 around open data, that we just open everything up and the world would be a better place. The first thing we realized is that there's different kinds of data, and that data needs to be handled different ways. The Humanitarian Data Exchange was originally designed for public data in the spirit of open data, that it would be there, anybody could use it. We've always banned personally identifiable data just for the reason that we didn't have any way to protect it properly, and we didn't want to take that burden on ourselves. Or expose people to the risk of having their private data shared that way inadvertently. Over time, we've developed a more nuanced approach to sharing on HDX, which this little diagram and the various arrows illustrate. And we classify data as non-sensitive. We know for certain it's not putting people at risk. This would be, for instance, aggregated data about nutrition aggregated to the, say, district level. General statistical information, high-level information about a humanitarian response. We have uncertain sensitivity, which is where a lot of data falls, where you're not quite sure. You think it's safe, but you haven't had a chance to get a professional review to the sense that you're entirely confident about it. And then sensitive data, where we know that if the data were shared, and again, as I mentioned, we don't allow personally identifiable information. So we don't have things like raw survey results. But even then, data can be sensitive. Community identifiable data could draw attention to small groups of people, vulnerable people, say in refugee camps, or international organizations doing work in sensitive areas that might put their workers at risk. So that information is still considered sensitive, even if it doesn't have information about individuals in it. And we've developed different ways of dealing with this data. So non-sensitive data, we want to be public. And if it's not sensitive, there's no reason not to make it available to everybody, say high-level census data, data about the response, et cetera. Uncertain sensitivity is a judgment call. We have facilities and tools available to help evaluate data for inadvertent exposure. And we can help review it with you. If you decide it's safe, you can do it publicly. Otherwise, we have a private data sharing option where you can share the data, but only within a certain group of users who you authorize. Then we recently introduced a third level, which is we call HDX Connect, where we never take the data at all. What you do is you put metadata about the data, essentially a catalog entry on the Humanitarian Data Exchange. And then people can send requests through the website to you, and you can verify them, verify that they're where they say they're from, that they have a legitimate use, and you can decide whether to share or not. So we just manage the communication for you. And then obviously there's always the option, just don't share. If the data is not safe, don't go there. And I'm very much looking forward to what people have to say during our discussion afterwards. Slide, please. So going past that, we realized that OCHA in general, the Office for the Coordination of Humanitarian Affairs, we have offices in many countries around the world and regional offices as well. We realized that data protection and data privacy go beyond individual decisions people are making at the spur of the moment. That it's not just about data privacy or data protection, but data responsibility. And data responsibility means not just making the right decision in the spur of the moment, but it means setting up your organizations and processes so that they're designed to protect data and they're designed to make good decisions about privacy. Last year, on behalf of all of OCHA, we developed the draft data responsibility guidelines for OCHA offices. The link will be shared with you. This is freely available. Well, it's designed specifically for OCHA. Other organizations have shown a lot of interest in it, and it might be worth a read just if you're thinking about how to shift your organization from making ad hoc decisions about privacy to being an organization designed to protect data and make good decisions about it. I think it's worth a read. It's not too long a report. Next, please. The report has a whole series of steps and checklists that we recommend offices go through for a data set, deciding whether it's data that should be handled in different ways. And it comes up with 4 levels of classification: public, restricted, confidential, and strictly confidential, depending on the outcome of those checklists. You are very welcome to adopt those checklists for your own organization. And what we hope from this is it will give people more confidence, both to share data, knowing that it's safe to share, or to keep data back knowing it's not safe to share, rather than being stuck in that muddy middle where it sort of might be okay, but it's not, and you don't really have the processes or guidelines in your organization to make that decision. Slide, please. Now, we've been talking about privacy and protection, but another big push in OCHA since 2011 has been precisely what your organization that you're all participating in is most interested in, which is sex and age disaggregated data. We use the horrible acronym SAD for that. I hope there's a better one in the rest of the community. But this work was triggered by the 2004 Indian Ocean tsunami. In that tsunami, afterwards, when they were analyzing the data, they found that the effects were disproportionate based on sex and age. 4 times as many female people as male people were killed in the tsunami. And the victims were disproportionately children and the elderly. Because of the gender disproportion of people killed, it meant that there were many households where the sole head of the household or the sole parent left was a male, sometimes in cultures where the men didn't have the skills to care for children properly. These are all things that we took too long to figure out back in 2004, and we wanted, looking at it after the fact, to get better at it. So we've come out with the guidelines, and it's been a slow process, but OCHA and the UN-led humanitarian community has gradually been getting better at this every year. Most of our annual humanitarian needs overviews and humanitarian response plans now include sex and age disaggregated data, and the next thing we're moving towards is disability disaggregated data as well. So big organizations move slowly, but we are moving. Slide, please. The last resource I want to talk about before I throw out my question for discussion after Jessica's presentation is the idea of minimum viable data. My colleague Simon B. Johnson at the British Red Cross wrote a great short blog about this, that we'll be sharing the link with you, arguing that organizations in general collect too much data just in case. And every bit of data that we collect is something that we can accidentally disclose and harm somebody with. It takes time and money to collect. If we're collecting that, we're not collecting other data. If we collect too much data, we don't do it as often, so our data is out of date. And Simon makes the argument that it would be better to collect, and he's been working on this in the British Red Cross, collect only the absolute minimum data we need. Never ask for data just in case. Take data only because we know that we can do something valuable with it now and safely that will help people and protect people. And I had personal exposure to this during the West Africa Ebola crisis. I was in a conversation with officials from the Liberian Health Ministry, and they told me one of the biggest innovations that helped speed up the Ebola response had nothing to do with technology or apps or medicine. It was simply shortening the paper case tracking forms that came from the county hospitals from 10 pages down to 2. And that shortened their backlog from 2 weeks to a couple of days, which meant they could enter them faster into their database, and they started to be able to get on top of the crisis. So minimum viable data is something that's certainly worth talking about. But this brings us to the quandary. On the one hand, we know we need to collect more and better disaggregated data. We need data that's disaggregated geographically, by sex, by age, by disability, so that we can shape our humanitarian response so that it's providing the appropriate help to the appropriate people. On the other hand, we know the more data we collect, the more time consuming it is, the more out of date it's going to get, and the more danger there is of risk and exposure. And that applies especially to data that's shared publicly. So the question I'd be interested in discussing when we get around to the discussion is, how do we balance these two? How do we know we're collecting as much data as we need and not anymore? How do we know that sharing data will help the response, and how do we know when it will hurt people? So I'd love to hear some of your own experiences from the field. Slide, please. So that's it for me. Please, I hope you have a chance to visit us and at both our website and our Twitter feed. You feel free to send us an email, centerhumdata@un.org, and we'd love to hear from you. And thank you very much, everyone, for the opportunity. I'll look forward to the discussion in a little bit. Over.
Thank you so much, David. We actually have a follow-up question for you, if you don't mind sticking along for a bit.
Of course.
The question, thank you, comes from Marzi Agadi, who is asking, how can we apply a gender-based analysis plus, so GBA plus lens in data sharing within HDX? If you have any thoughts to share on that.
Well, there's 2 ways that we want to apply that lens. There's apply the lens to the quality of the data that we're sharing, but also apply the lens to the people who we're sharing the data with. So on the first hand, we are starting to analyze our data as a whole, the 17,000 plus data sets, to take a look at what there is as raw material for more advanced types of analysis. On the other hand, it's very problematic. We are using Google Analytics, and I personally find it very problematic because it will make guesses about the demographics of the people who are actually using the data, but it's very intrusive in the way it does it. If we don't know that, if we don't know who's using the data, we have only half the picture. We know the we know what's being viewed, but we don't know who's gazing at it. So I don't know if that helps answer the question or just raises new questions, but it's certainly something that troubles me. That how much, to what extent, when we do data sharing, are we sharing it towards it's for the benefit of people in rich countries who look like me, versus for the benefit of people either trying to build better lives for themselves or doing the work to help other people build better lives for themselves in affected countries. I know that's not a great, I'm not an expert in gender-based analysis, so I can't go into more detail than that, but those are the issues that occur to me right now.
Absolutely, David. And I think what you just said around this conversation actually raises a lot more questions that I'm hoping all of us in the sector can continue to mull over. So those are very fair questions to consider. I will save more of the Q&A that we have for the discussion. But before that, I'll actually hand it over to Jessica Ferne, Director of Global Health Impact here at CanWaCH, to take us away on the Project Explorer tool. Over to you.
Thanks a lot, Antu, and thank you, David. That was great, and I'll try to keep my remarks brief, although those of you who know me know how challenging that is. I could talk about this for a long time because I think, yeah, in this conversation we're raising a lot of questions that we need to explore. So for those of you I haven't met, I'm Jessica Ferne, the Director of Global Health Impact at CanWaCH, which basically means I work with all things data related. My pronouns are she and her. And like David, I've actually recently relocated to Ottawa, the traditional territory of the Algonquin people, and I'm very grateful to be here. So in my remarks, I'm going to talk a little bit about what the Project Explorer is, which is it's an initiative of CanWaCH, and what we've learned through the process of building it, and really what we're hearing from the Canadian perspective. So if you haven't heard about the Project Explorer before, we kind of think of it as a centralized repository of global health and development projects with a Canadian connection. And what we mean by Canadian connection is exactly as open-ended as it sounds. So a lot of people assume that we are only ever talking about projects funded by the government of Canada. But in fact, this came about in large part because we wanted to have a place where we could show projects that involve Canadian organizations or diverse sources of Canadian funding, but that also really reflect the priorities and the commitments of Canadian organizations. And so in building the tool, we really had kind of, well, first of all, we really had 4 key goals in mind, and I often frame them as searching better, understanding better, delivering better, and coordinating better. And what I mean by that, well, first of all, on the searching front is that we wanted to create a place where you could search fairly intuitively, both open and closed projects. We wanted to be able to have that history and be able for you to quickly find and have at your fingertips information on the health and development work that Canadians are doing. But it's not sufficient to just have data. You have to then understand it and be able to interpret it in a meaningful way. And that's why over the last little while, and in a minute, I'll show you some examples, but we've been really prioritizing the visualization of data and using open source platforms like Tableau to be able to create visuals. We also spend a lot of time cleaning up our data and making sure that it's in a CSV format that you can download and use yourself for your own analyses. And when we talk about delivering and coordinating this, and I'll talk more about this in a second, but this is really when we get into the use of data and the many different uses of this kind of open data. So we wanted people to be able to see where there were opportunities and gaps, be able to quickly map and see where projects were happening with which partners, who was funding what kind of work, and what the history of that had been, so that you could use a platform to be able to reach out and plan, not just share what you're currently doing, but actually plan and look ahead. So a couple of other things that I think are important to know or to have in this context. First of all is, we're, as the name CanWaCH suggests, we have a particular interest in global health and gender equality and projects that sit at those intersections. But for me in particular, it's really important to take a social determinants of health perspective. And we know that health, especially as we're seeing right now, health and global health intersect with so many other areas of development. So the Project Explorer as a tool is sector agnostic. It is open to anyone. You do not have to be a member of CanWaCH. You don't have to do projects that are traditionally associated with women, adolescent, and child health. Women have children. They also drink water. And so bringing that gendered analysis to all areas of health and development is really important for us. We also wanted to be able or to create a platform where people could contribute on or offline in multiple formats and really have expanded usage. When we were designing the Project Explorer tool, and the idea was kind of first being put forward, this was really because we wanted to kind of avoid the siloed nature, and David spoke a bit to this about how, if you only have, for example, UN OCHA projects, you're only getting one part of the picture. We wanted to have projects from a variety of different funders. We also wanted to be able to go beyond what we kind of say the basics of data, the who, what, when, why. And this is, I think, really important for us in the Canadian context, of course, under the current feminist international assistance policy. With that focus and with Canada's commitment to taking a gender transformative lens to programming, looking at human rights issues, there are particular aspects of data that don't often get called out in other traditional sharing platforms or other existing sharing platforms. And having those Canadian priorities there was quite important for us. It was interesting, David, to hear you talk about the HDX Connect, that ability to go kind of what we're saying is like data plus. So not just the raw, bulletin board of project information. We also wanted to be able to create a space where folks could share data sets. And as you say, making it clear who people can contact if they want the raw data, but letting people know when data is available. But because we also engage research communities, health professional associations, we wanted to have a place where you could see what tools were created in relation to that project or to collect that data, what publications have come about. And so now in our platform, you can add and collect these things and search for them in that way. And ultimately, this reflects our commitment to our view of data sharing as being more than just kind of accounting for dollars. I'll say more on that in a minute, but I think it gets to this question of questions of good enough that you just raised there, David, with the minimum viable data question. What kind of data do we need to inform our decision making? We often talk about data sharing in the sense of accountability and value for money, and that's one piece of it. But what does it mean to have and leverage a platform to inform your prospective decision making? Melody, if you could just kind of cycle through the next few slides. I want to just show people this, for example, that you're looking at is an example of an individual project page where you can really see some of the breakdowns that we've got. But in the next slides, you'll see things like these geo-coordinate level maps that are quite important for us so that you can really go down to the street level view of where folks are and who the local partners are that they're working with. And that's been really important for us as well, is to be able to have this repository of local grassroots-based partners as organizations look to plan who can they work with as we promote local leadership. How do we identify those partners? These are some of our snapshots. We have a global snapshot. The next slide has our country level snapshots. These let you look at trends in Canadian programming at a whole, but also let you dive down deep into country issues, looking at key themes that have emerged and what the trends have been in those areas of funding over time. We're also, and this one I'll pause on briefly, to this question about age and community disaggregated data. This is something that we've been exploring and getting great feedback on, looking at not just direct and indirect and not just gender in a binary, but really teasing about categories of age, newborns to older adults, but also looking to track things like Canadian programming that involves connecting with IDP communities, LGBTQ2I communities, persons with disabilities, urban or rural populations. These let us really look and at a glance understand who we're working with and to be able to connect organizations to learn and share best practice. Next slide, please. And this one, and we have other visuals, but again, touching back on this question of the diversity of organizations. Civil society, of course, is a huge part of it. But then there's this question of where do you go for data on things like private sector engagement? How do we capture the role of academic and research communities in these data sharing platforms and make sure that that information is available to, let's say, programming implementers to use to inform their work. These are all things that we're trying to explore, but we're really at the beginning of our thought process on them. Next slide, please. This one is just a very quick example of this work in practice. So if you're part of a working group that CanWaCH has, our Haiti country working group, we've actually directly applied the Project Explorer, again, not just to do a synthesis of where Canadians are working, but actually to develop a detailed map of, many of your organizations are probably here, where folks are working in Haiti, with whom they are working. A map that looks just like this is, I believe, with the Ministry of Health in Haiti, so that they can understand where Canadians are in country and use it as a mechanism for relationship building. So these multiple uses that go beyond just tallying up dollars spent, I think really gets to that optimistic approach of how and where and why we can use this kind of data. Next slide. So really quickly, I'm going to talk about, as we've been going through this journey, we obviously connect a lot with all of you, with the Canadian NGO sector, to hear your views and your concerns and your questions, and we'll hear a bit more in a second. These aren't all barriers, but these are things that have come up repeatedly as questions or concerns, and love to hear your thoughts in the chat about it. The first point about navigating questions around data validity, completion, and updating, this is probably one of the things we get, a lot, because we're not just taking projects from a given funder. It's not like we have a denominator, right? We don't know what the ultimate number of projects that Canada is ever doing. We can't know that, and so we can't ever say, do we have every single project? Do we have all the details on every single project? A question I saw, and that comes up a lot, of course, is this matter of timeliness. And for us at CanWaCH, we take the perspective that reporting organizations, the organizations doing the work, are the best placed to say when projects are, what the details are, if they're up to date, and to actually put as few steps as possible between you and telling the story of the work that you're doing and that your partners are doing on a platform. But then we get questions from others around, so the verification of that data, and if in fact that is the point of these kinds of data sharing platforms. The second one, I called it here familiarity with global standards and reporting. And I know we have some folks on the line here from Global Affairs and elsewhere that are familiar with things like the IATI standard. When I joined CanWaCH, it really, and I started having these conversations, it really struck me that the knowledge and familiarity with these standards and the sense of what was involved in using or reporting into these bodies or using these standards, it really varied. I'm actually curious if folks want to write into the chat. At the beginning, you shared some of you have shared data before. I'm curious to know how familiar folks are just here on the call as a snapshot with IATI. But we are asking ourselves a lot, if the Project Explorer tool can be a way of strengthening knowledge and capacity, and also to help organizations to learn more about how to do this so that they can participate in these other platforms. And again, we're not the only platform. So this question too of the burden on NGO time, the coordination and the effort, especially if you're part of a federation that's involved in contributing to these different platforms, making sure that there's coordination, consistency, and updating. These are real challenges that organizations share with us. We think of ourselves a lot on the Project Explorer side of being able to pay that, what I've heard called like that collaboration tax, or in this case, the coordination tax. So helping organizations who share our data or share data with us to take on the responsibility of sharing and connecting elsewhere. And that's something we'd love to we'll talk more with HDX about to make that easier and less time consuming for you. And this point about I can't take credit for this expression, telling a story versus telling the story, but it really stuck with me when I heard it. And this is the question when it comes to data sharing about the question organizations often raise about how their work will be portrayed. And we could have lots of conversations about aggregation and when and how it's useful and when it's not. But when information is up and out, there is the potential for it to be used in different ways, misused. We like to give organizations control over what they share and so how they appear, but data isn't neutral, and there are and how we at CanWaCH choose to display things through the Project Explorer is a choice. We have an articulated methodology, but it's definitely a choice. And then David, you talked a lot about this point, so I won't say more on the issue of security, but it's definitely a question that's come up a lot. Right now, CanWaCH is working on and you'll hear about it, we're working on a report that many of you have contributed to about the impacts of COVID-19 within the context or with the lens of the impact on data and information. And one thing that I heard loud and clear through some of the interviews that we've done on this is a real desire for support, guidance, and information on issues around data privacy, data management, but also technological support. Resources like the one David shared are great, and at CanWaCH, we'll be making it a priority over the next little while to get more of that guidance out and available to our members and our sector colleagues, and also to think about how we can add the Canadian voice to it. Next slide, please. So I'll kick it over to Antu now, but these are just, these questions are the questions that we grapple with, understanding kind of the changing perspective, and we want to hear from all of you, the changing perspective on your appetite for these kind of central data sharing platforms, how we can resource and provide support or take on responsibilities to lessen the burden for you to get that information up and out there. And then, of course, what really concerns and interests me is this question of how do we make sure that data doesn't just, be used as a reporting or accountability measure, but actually is something that you engage with to inform your programming, particularly in this new context where we will be challenged in a lot of areas around primary data collection, and we'll need to think more and more about how we engage with these platforms, ours and others. So Antu, maybe I'll stop there and turn it over to you so we can discuss.
Well, thank you so much, Jessica and David. I think you laid a really great stage for many of the questions that I'm hoping folks have with them today. And so one of the questions you already have to understand what you've taken away so far is the next one. If you could switch to the next slide, we're going to be polling you again. So the question here, after what you've heard, is what keeps you from sharing your data? And so I'll ask Tina to launch the poll. There you go. There's a few options, and you can select multiple, as there could be multiple reasons. But I can read them out loud if it helps. So number 1, concerned about maintaining privacy or confidentiality. Number 2, not convinced of the return on investment in terms of time and resources, as Jessica mentioned. Number 3, concerned that the data is not robust enough to share. 4 is do not know how to share the data. And then number 5 is finding that shared data is unreliable. If you have other reasons why you are not able to or have not shared data, we encourage you to respond in the chat box. And we encourage you to respond in the chat box to any of what you have heard so far. So we'll give it a few extra seconds. Okay, so we'll see if we can see what folks are saying. Okay, so, and this is a theme that has come up quite a bit, is concerns around maintaining privacy and confidentiality. So that seems to be one of the major reasons at 57%, but that is followed very closely by concerns that the data is not robust enough to share. And following that is that we are just not convinced that submitting to data sharing platforms is a good return of investment in terms of time and capacity. So I think that actually sets a really great stage for a lot of the questions that we've received so far. And one of the main ones that I'll let David also speak to is around timely data collection. And what we heard from Maggie Zhang is the question of how do you ensure accuracy and time-fast application in data collection within humanitarian settings. There are a few other questions, so I'll just go one by one. Over to you, David.
That's a great question. It's essentially cold fusion or squaring the circle as far as we've seen so far. You can have good data that's out of date, or you can have messy data that's fast, but we've never figured out how to get good data that's fast. I think there's been a lot of tendency to lead with the technology, to build apps to try to collect the data is one of the big ones, to use machine learning, to use automatic sensing. And we get some useful data from that. For instance, there are projects that use satellite imagery to analyze population density before and after a disaster. That's great. It's obviously not disaggregated at a meaningful level. We don't know age groups, genders, we don't know demographic identities of any kind in that case, but we can get the data fast. But in the end, the operational data that humanitarian responders have to work with in a sudden onset crisis or fast changing crisis is messy, and we have to accept that it's messy. It's estimates, small samples expanded based on census data, guesses based on people's experiences, data sets that haven't been fully cleaned. And part of what we've been trying to do is get that understanding out there. We don't expect data to be perfect. A good example of this is the OECD. They collect data on aid projects from Canada and all other countries. It's beautifully internally consistent, clean data, and it's 18 months old. So if you want to know what was happening 18 months ago, go to the OECD. IADI, which Jessica mentioned, on the other hand, some aid organizations publish it every day. It's self-published, nobody's validating it, but it's up to date. So OECD can give you a number of activities. Jessica asked the number, how many projects are happening from Canadian organizations. OECD will give you a number. It'll be a very definite number. It will be way low because it doesn't track everything that's happening. IADI will give you a number, but it will be a horrible, messy number because 3 organizations might report the same projects. You can't know. So I'd like to say that I've been in IT since the 80s. I'd love to say that we have a magic solution to hand over, but we don't. Nothing that we've tried has fixed that yet. I think maybe cold fusion and fast, clean data will happen someday, but I'm not holding my breath. Do you want to add to that, Jessica?
No, I think you've said it very well. It's an ongoing challenge, and we with the Project Explorer take the approach of allowing organizations to give us their data directly, but we also recognize that we're including both longer term development programming as well as humanitarian data as well, and that's something that we're having lots of conversations with our members on is the different types of data that they're collecting and able to share with us. And so I think your perspective from looking specifically at the humanitarian data and its own particular challenges is quite important.
And I think, this conversation that we've been hearing about heading towards a one platform or a one-stop shop leads us to the question that Stacy Sawchuk from Action Against Hunger, hi Stacy, poses, which is centralized data sharing tends to be one way that information is used. How can we move to a format that centralized data serves a purpose for more than just headquarters or governments? And can there be input and use by local communities? So who actually accesses the data at the end is a really good question there. So over to you, David, if you'd like to share your insights.
Certainly, I'm glad the question came from ACF because there's actually a good case study there. We set up field offices early because we knew they'd be important. And ACF has been an important data provider in West Africa and the Sahel, specifically through the work they've been doing with satellite monitoring of vegetation density, which is information, unlike headquarters, and this isn't, for the statistics in the annual report at a UN agency, this actually gives an idea of what animal herders will be facing over the next few months, and actually gives local authorities a chance to help direct them towards places they'll be better grazing, versus just projection from rainfall and meteorological data they've used in the past. So in certain areas, we can get good, fast, automated, actionable data, and I think that case is a good one. In general, though, it is a real problem. And I haven't had a lot of time in the field because I came to aid late, but the experience I've had made me realize very quickly that there are two completely separate silos of data. There's the data that people use in the field, which is swapped around like horse trading on USB sticks at meetings in cafes or wherever. And then there's the official data that leaks out of the country to headquarters, which is nice and clean and designed to make everything look well organized. And again, I think operations in the field, whether it's from the local governments or from international responders assisting, they do a lot with that imperfect and messy data, but it's not the data that headquarters sees. And I think that drawing attention to the headquarters versus field, or whatever you want to call it, I'm not sure if field is a patronizing term for it, but the headquarters versus operational view of data is really important. And it's another problem that hasn't really been solved. The data that trickles up to Geneva or New York or London or Ottawa is only a really tiny sample of what people know who are actually doing the work. And IADI has the same problem. IADI has some field reporting, but it's very much DFID's or Global Affairs Canada's or USAID's view of what's happening. It's not the view of the organizations that are actually doing the work or their local partners out in the field.
Yeah, thank you, David. I think that this is such an important question. And I mean, from my view, and that's why we framed our interest here is really around data for decision making. So there is that element of what gets put out there, but then there's the data sets that we can actually use to guide where we should go next. for us, with the Project Explorer, we really think of it as an opportunity to connect folks. And David, you talked about this as well with the HDX Connect, right? We recognize that the data that you share with us in a lot of cases will be, you know, a version of a snapshot of where your project is at a moment in time, but also by being able to share some of the tools or highlight what data sets or publications are available, but also by providing information and contact details. We're hoping that this will allow Canadian organizations to connect with each other, and also in country, our local organizations to reach out to Canadians and vice versa, to be able to talk about the programming and the data and what is available. So not necessarily that these centralized platforms will house every single piece of data, because as you said, David, there's lots of very confidential, detailed information that we know organizations will work together to talk about, or maybe locations where people are currently working can't be disclosed for safety reasons. But if we can be a place for you to connect with each other, a data dating site, it came to my mind. I don't know if that's an appropriate term for it, but a way that you can reach out to form those relationships and connections and go from there. I think that this is really, at least for me, where a lot of the opportunity lies for us to take advantage of these platforms and make them work for us.
If I can just add to what Jessica just said, this is a big problem, as I know many of you who've been deployed to humanitarian responses know. In a long-term crisis, you tend to get a lot of people staying in the same place for the same time. In a sudden onset crisis, or a crisis where people have to rotate in and out very fast, those relationships are fragile and they have to be rebuilt every time. So some kind of a dating service, you know, swipe left, swipe right, whatever you want to have, has a lot of value in making those relationships more permanent than personal meeting over a coffee relationships that drive much of humanitarian data sharing in the field right now. Thank you.
And that actually brings us to a great question. And I'm skipping a few because of the flow, but we'll be sure to get to the others. How can we promote these tools amongst organizations? So effectively, how can we make this dating norm a norm? And are there some specific ways that you both have any suggestions?
I'll start off with this, only to say that that just came to me now, and I'm determined to find a way to put in a swiping option into the ProX. So everybody stay tuned for technically figuring out what that looks like. In terms of how to promote it, I mean, there's a lot of questions here around capacity, and as the poll showed us, right, capacity, resources are a big concern, and when you're trying to decide what to do with the limited bandwidth that you have, particularly if you're the M&E or program officer, you know, deciding that you're going to take some time to fill out and continually fill out and update our data forms. We know what we're asking, and we know that's a burden. So I think, and one thing, you know, a simple thing that we're working on is just really easier to digest communication materials that talk about where and how it can be used, and getting at some of these challenges. But I think that without looking at the capacity and human resource burdens, it's going to be a challenge. At CanWaCH, what I can say is that we have a team that is able to back up this work, right, is to help people collect their data. We enter it for them. We have conversations about your data and what it would take to get it into a place where it could be shared. So if that's you and you want to have those conversations with somebody who can really talk to you about that and what it would look like for your organization, reach out to us and we'll be sure to help you with that. But I think that unless people are very clear on where and how it's going to benefit them and their work and make things more meaningful for them today, you know, you'll be pretty hard pressed to move the dial. So I think those of us that see value in this really have to take on that collaboration tax, as I said, and work together to see what we can do to streamline this process, reduce the burden, not ask for things we're not going to use, and that we don't think other people would want to use, while at the same time getting the kind of nuanced, detailed information out there that we need. David, do you have a more useful answer to that?
not more useful, but I'd be happy to add a little bit to it. OCHA actually did try to build that dating app. It was called Humanitarian ID, where people could connect with other people working in the same location. It did not take off, probably because we didn't have swiping. So I'm hoping that when Jessica adds that, it will make everything work. I think the other thing is, it's easy to get cynical, and you've certainly heard some cynicism from me today. But sometimes you have to listen very carefully to find the success stories. A few years ago, we had the International Open Data Conference in Ottawa. And as a side event from that, I think it was 2016, we had an International Transparency Initiative meeting. And we had a whole series of sessions looking at case studies. And we just weren't hearing a lot except the same old stories. And everybody was getting a little down and cynical about whether IADI was actually helping anybody but headquarters or actually getting information to the people who need it. And we had one more session. They asked me to chair it, and I decided to chair it in my bad French and make the Anglophones put on the simultaneous interpretation headsets for a minute. And as soon as I did that, we started getting really useful case studies pouring out from people in Francophone countries, especially Madagascar, where they came and they said, well, it's great that these big countries say they can just go straight to the donors and straight to the UNICEF office and get the information there. They said, we're too small, we don't have these. Since IADI came out, or sites like your Project Explorer, that's the only way they can find out what's happening in their country. And I think it's worth looking for those and maybe building on them, because not everybody's big enough to have the other channels that many countries with aid responses have. So those are just a couple of little points to add to it.
Well, a couple little points that I'm sure that we could all have like a very long discussion on, David, and which makes me sadly have to say that we are at time. And for all the questions that we did not answer, we will try our best to follow up with those specific participants. I see your questions, Patrick, and we'll get David to connect with you. So if you'd like to connect further with David, he's on Twitter. Feel free, as well as with the CanWaCH team around our tool, the Project Explorer, and everything Jessica has touched on at metrics@canwach.ca. I do want to leave you all with the thirst for more data webinars and this conversation. We're having a month-long series of webinars that focus on data, and the one that you may particularly also want to sign up for is the pandemic report launch, where we hope to share with you some of the lessons learned and things that we're hearing from members at CanWaCH around how they're responding right now to COVID with respect to data-driven decision making. So please do sign up at the CanWaCH events. We can actually get a link actually here for you for those that can sign up, but just really want to say thank you so very much to David and Jessica, both of you, for sharing your wonderful insights. This is very much the start of bigger and more conversations. So I hope that everyone has a lovely afternoon, morning, wherever you are, and we hope to see you on our next webinar. So thank you all so much. Cheers.